The definition of service is the assistance provided to others. It encompasses various forms of aid, support, and assistance to people in need. Based on our in-depth research and actual observations during our site visits in downtown Calgary, we identified that emergency shelters, food services, and healthcare facilities are the top 3 services required for homeless people. According to the Canadian federal government, emergency shelters are the only safe and temporary housing option for homeless individuals. In addition to these critical services, transportation is also often a barrier to homeless individuals. As per the City of Calgary, public transit services are often the sole means of travel for those experiencing homelessness in Calgary. Food services play a crucial role in addressing hunger, promoting health and well-being, and supporting individuals experiencing homelessness on their journey towards stability and independence. It also provides a sense of dignity and respect by offering them access to meals in a safe, welcoming, and non-judgmental environment. In 2022, Food Banks Alberta reported $4 million in in-kind donations. Rising food costs and meeting the demand for food services constrain resources and capacity, where the total amount of food costs for struggling families is exponentially more than the donations received. Shelters play a very important role for homeless people. Based on the University of Calgary School of Public Policy, there are around 115,000 Calgarians who are currently at high risk of becoming homeless. Additionally, there are 350 new Calgarians who become homeless every month. Ensuring affordable housing and robust social systems can make a significant difference in addressing this critical issue. Emergency shelters peaked at 12 in 2017, but decreased to 9 in 2022. Approximately 29% of the Calgarian homeless population do not use shelters. 45% of those have stated that they do not use shelters for fear of safety, and 4% have mentioned pets are a reason for not using them. Healthcare for homeless people is impacted by the complexity of the homeless population. Complexity referring to the level of a person's need to overcome the barriers that prevent them from maintaining permanent housing. The Calgary Homeless Foundation focuses on 3 types of personal barriers: physical health problems, mental health problems, and substance misuse problems. If a person faces 3 kinds of barriers, they have trimorbidity, and if they have 2 kinds of barriers, they have bimorbidity. Based on morbidity, a level of complexity is defined for the homeless population. High complexity refers to people who are trimorbid and are the most vulnerable in society. Moderate complexity refers to people who are bimorbid and face difficulties in existing homelessness on their own. Minor complexity refers to people with only financial barriers, not any personal barriers that exist independent of short-term intervention. Transit services are provided to enhance accessibility to all of these services, as well as to promote equity, protect the environment, and contribute to overall community well-being. Although there can be private companies in charge of the development of transit services, decisions are usually made on the governmental level. In spite of this, dramatic increases in Calgary's population since 2013 have not translated into meaningfully significant increases in bus routes, creating a situation where demand for public transit is 3 times higher than supply. As such, public transit is becoming increasingly unaffordable in Calgary, creating a gap between homeless people and the services they need. In pursuing a more compassionate and inclusive society, we recognize that addressing homelessness requires a multifaceted approach that weaves together essential services such as emergency shelters, food provisions, healthcare, and accessible transportation. Let's ensure that homeless individuals have equitable access to medical care, mental health services, and addiction treatment. Let's provide adequate food services that nourish bodies and spirits through community kitchens, food banks, or meal programs. Together, let's create a safety net, thread by thread, by providing adequate transportation services. By addressing these critical services, we create a community where everyone has a chance to survive and thrive, a place where bridges lead to brighter tomorrows. Remember, our collective efforts matter. Each act of kindness, each policy change, and each extended hand has a significant impact and a significant step towards a more supportive world for homeless people.